Okay, wait. Today her topic is why discharge. Every other woman wants to get rid of this discharge and wants to let it go. So let us learn to diagnose and treat them. You might have seen a lot of patients coming to your clinic with a very common complaint of why discharge. Now, what you'll think about? Is it physiological or it is pathological? How to differentiate them? Ask the patient whether she has a purulent discharge, whether it is offensive, or is it associated with itching. If the answer is no, then definitely this is physiological discharge. If the answer is yes, think about the pathological causes of discharge. What are the physiological causes of white discharge? During the puberty, during the menstruation, or during the pregnancy, also there is a chance of physiological white discharge. The cause is increase in estrogen. What are the other causes? Postmenopausal lady, if there is any increase in white, if there is a white discharge, then it is senile vaginitis. And if it is a premenarchal age group, then the patient is not having proper nutrition. And also some neonates might also have this white discharge. Then if you're thinking about the pathological causes of white discharge, then how to proceed further? First, you ask the consistency of the discharge, whether it is curdy white or not. If yes, then you ask how is the itching. If itching is more where it is out of proportion than white discharge, then we should think about the candidiasis. Correlate with the patient's history. Ask whether the patient is diabetic mellitus and ask whether the patient is on any steroids or ask whether the patient is taking any broad spectrum antibiotics. If the patient have thyroid also and also if the patient is obese. These are all the risk factors which leads to candidiasis. Treatment of candidiasis is tablet fluconazole 150 mg stat followed by you can also give a local lotrimoxazole 1% cream, and also you have to treat the husband with nystatin ointment. If the patient tells the white discharge is not curdy, then there are two most important causes. One is bacterial vaginosis, which is not a sexually transmitted disease. The second one is trichomonas vaginalis, which is a sexually transmitted disease. How to treat them? The treatment is common for both of them, that is tablet metronidazole 400 mg BD for 7 days. If it is bacterial vaginosis, the husband treatment is not required. If it is trichomonas vaginalis, treatment for the husband is required. At a PHC level, you cannot really differentiate them based on alone the clinical signs and symptoms. You really need a culture and that further testing to confirm these organisms. So we follow a syndromic approach for the treatment of these diseases. If there is any vaginal discharge associated with urinary symptoms or just itching, you prefer to give a combination treatment for both of them. The kit contains tablet fluconazole and tablet secnidazole. Secnidazole covers bacterial vaginosis and trichomonas vaginalis, and fluconazole is for candidiasis. The color of the kit is green color. Very important thing that to be noted is this metronidazole is contraindicated in first trimester of pregnancy and also the fluconazole tablet. So please give them plain local clotrimazole ointment, as pregnant patients are more prone for infections. Most commonly there will be associated candidiasis with them. You can advise the use of condom for the partners in order to prevent recurrence of these infections. Thank you.